Hello, I'm Yutong. This presentation addresses my positioning as a dance movement therapy researcher through the lens of reflexivity. And what is reflexivity in research? Reflexivity refers to the way a researcher clearly describes the contextual intersecting relationship between the participants and themselves. This approach is especially significant in research because knowledge is based on interpretive-based perspective formed through researchers' lenses and therefore unavoidably shaped by researchers' personal stances. And it is impossible to eliminate all biases. As a result, one way to address these influences is to disclose the researcher's position and identify their potential implication for the findings. This can make the findings more credible and provide readers with more contextual information to evaluate the research. Finlay proposed 5 approaches of reflexivity based on the researcher's focus. In this presentation, I will mainly draw on the reflexivity as introspection to examine how my personal and professional experience influences the research orientation and assumptions. In addition, I will also use Berger's framework of researcher positioning to identify the implication of my outsider perspective in relation to the target population. So, who am I? As a DNT student researcher, I am a 32-year-old man from Taiwan. I have experience in various dance styles. I studied traditional Chinese medicine, TCM, and worked in both hospital and clinics in Taiwan. In research, I want to study how DNT and body-based approaches can help people with medically unexplained symptoms and chronic pain. My ontology and epistemology stance. My stance on ontology and epistemology depends on the context. I believe that reality exists in different forms and that reality can work differently depending on the way we frame the question. For example, if we investigate how to elevate, ele- elevate it, elevate the pain level of headache in context of Western medicine, there may be fixed truths about physical pain in biological and pathological models. However, if we frame the aim differently as how to mitigate the suffering of patients with headache, the investigation may pivot to a broader level that involve not only physiological issue but also psychological and social facets. Patients' relationship with pain, their lived experience, and their cultural context may collectively shape how the suffering is experienced. In this sense, I believe that there may be multiple truths when reality is related to human experience. If we want to investigate the multifaceted knowledge, we need to incorporate different paradigms. This context oriented viewpoint is possibly affected by my TCN education, where I was trained in both scientific perspective of Western medicine and the philosophical perspective of TCM. Western medicine training emphasizes on the biomedical model, which regards the body as a system of biological mechanisms, while TCM adopts a holistic view to understand the body in relation to broader natural environment. These two medical systems may interpret the same health condition through different concepts. We also we were also encouraged to communicate across perspectives and integrate both frameworks to better capture the full picture. This experience is similar to the process through which I form my stance in DNT. This stance may benefit DNT research as it encompasses a wide range of phenomena. It may lead to more comprehensive consideration of the well-being and help communicate findings across paradigms from the bird's eye view. However, this stance may also create some barriers. Firstly, attempting to address every aspect of a research issue may result in an overly broad research focus. It may possibly lead to findings that lack depth or a clear focus. There may not be sufficient funding or human resources to support such a broad scope too. Secondly, the intention to integrate different paradigms to research an optimal conclusion may be too idealistic, as the fundamental theories behind these paradigms across different facets. Attempting to integrate them may lead to an incoherent conclusion or parallel findings without a clear connection. My value as a DNT researcher. As a dance and DNT researcher, I value the somatic approaches and embodied data. This may facilitate more movement and bodily experiences and broaden the sources from which we gather information. However, it may implicitly assume that DNT is beneficial and that bodily experiences always carry meaning. These assumptions may minimize the experiences of patients who do not benefit from DNT or find meaning in their bodies. As an outsider researcher to people with chronic pain, I am not familiar with their experiences. One advantage is that I may bring a fresh perspective to the research and remain open to participants' experiences without preconceived notions. However, by the same token, because I may not fully understand their lived experience, I may carry the privilege of an able-bodied and design the research in a generalized way that does not accurately represent their individual experiences. As a TCM practitioner, the experience in the clinical settings sparks my interest in chronic pain and medically unexplained symptoms because in my cultural context, many patients seek TCM when Western medicine is unable to resolve their problems. My clinical practice also informed my holistic perspective on well-being. This value may lead me to frame the research in a biopsychosocial model and consider their interactions in the given context, other than physical pain itself. Focusing on patients' subjective experiences may present a more comprehensive understanding of how chronic pain affects their lives. Reflexively thinking, my value may facilitate useful research by identifying meaningful therapeutic factors that can support patients' specific needs. However, my value may also become interwoven with the research design that steer the finding toward a desired conclusion. For example, asking participants about their relationship with pain may induce them to search for meaning in their pain. This question already carries an interpretivist assumption that pain has personal meaning, although it may mean nothing to some participants. Thank you for watching.